Hey guys, and welcome back to our video training series on identifying and treating structural dysfunctions that are oftentimes the root cause of chronic pain. All right, finally, we've reached the video where we're going to talk about the principles of treatment. We've talked about what we're treating, these deep joint fascial and connective tissue restrictions in the joint spaces that limit these micromotions. We've talked about how do we discover them, how do we identify them through the recoil spring testing. And now we're going to talk about what really matters at the end of the day, right? Which is how do we release them, how do we treat them, how do we reset the system. If there's two really exciting takeaways that I want you to get from this, it's that the HESH approach is one, within your scope of practice as a massage therapist. That's number one. Two, that we have a better chance of getting longer lasting results with the approach that we're going to use with the HESH method than with traditional approaches to put movement into the system where micromotions are lacking, because we're going to enroll the nervous system in a way that it's not typically engaged and enrolled. I'll talk more about that once I've covered the other principles. So first, in order to treat properly, we have to know where we're going to place our hand or whatever implement we're using. You can use different types of fulcrums depending on what we're treating. You might be using your hand, you might be using a foam block or a tool or a ball. This also makes it possible for clients to do self-treatments at home as well, which is part of the HESH program to provide at-home exercise or at-home work for people that want and need that as well. So number one, we've got to know where to place our hands to create the pressure that we're going to create. So number one is placement. Number two is we have a specific angle, and that's going to be in accordance with the direction that the joint should be moving, that it's not moving. And number three, we're going to have a specific amount of force that we're using. And here we start to get into where we differentiate from techniques that go in fast and quick that don't enroll the nervous system. So we've got a certain amount of force. It's going to be enough to stimulate the nervous system, but not so much that it doesn't feel safe and it guards against it, because ultimately what we're trying to overcome is that guarding response. That's what we're trying to get to release, is that protective response in the nervous system that's being held there and shutting down the motion that we want to restore. So the amount of force is going to depend on the joint or structure that we're trying to work with. In general, the smaller the structure, the less the force. A larger structure is going to be a little bit more force. But in all cases, it's a very gentle approach, and it's going to be gentle for the client's body so that their nervous system feels safe throughout. And because it's gentle, it's going to be easy on your body as well. And you're going to be able to get these lasting responses in shorter time, even though we're going to have a sustained period up front in order to accomplish that. So quick review of what I've said so far. We've got correct placement, we've got specific angles, we've got approximate amount of force depending on what structure. And then finally, and here's where, if you want to just really differentiate between the HESH method and traditional ways of treating micromotion restrictions, we're going to use a prolonged, sustained force. How long is going to depend on the structure. Once again, if it's a smaller structure, it's going to be less time. If it's a larger structure, it's going to be more time. In general, the average is going to be 2 minutes for most joints in the body, but some are 30 seconds and some are very few are 5 minutes. The majority, by far, it's a 2-minute duration, after which time we're going to reassess to make sure that the motion's been restored. Usually it is. Sometimes it may require a second application of the same treatment. But it is that prolonged, sustained, gentle force that's going to allow the nervous system the time to sense what we're asking it to do and make a decision about whether it wants to consent to that movement and surrender and allow it back into the system. And I say back in, allow it to be restored, because that's what we're doing here. We're restoring natural movements back into the body. The other more traditional approach to getting these movements back into the system are high velocity thrusts that you may be familiar with from chiropractic, physical therapists, and other practitioners, depending on who they are and what's within their scope. But the reason with the Hesh method that we prefer the longer sustained holds, again, is that they're safe. The nervous system has time to adjust and consent. A high velocity, forceful movement that kind of overpowers the structure and forces a movement into the system, it may allow motion to be there initially. But if the nervous system, which is possibly the reason for the guarding and the protection in the first place, shutting down that movement, if it didn't consent to that movement, then there's a good chance that within a few hours or a few days that it's going to lock everything back down and return everything back to status quo. So that's where we get into the biggest differentiator. High velocity thrusts are going to have specific placement and angles. They're going to use more force and they're going to be faster. Hesh method, less force, longer period of time. Enrolling the nervous system. One other element of treatment that is very important to making the Hesh method work not only on the spot, but to getting those lasting, often permanent results, is that Jerry Hesh has identified common groupings of micromotion restrictions, and he's identified the hierarchy of order in which to treat them. So let's say that there's one pattern that has 4 different elements to it, 4 different restrictions that make up the entire pattern. If we only treat 1 or 2, we may not get the lasting result that we're looking for. But if we treat in the right order, the most important ones first, then we may not have to treat all and we may get that lasting result. But either way, we're going to treat the first most important one. We're going to make sure it's restored, and then we'll go to the second one, and before we treat it, we'll check. Does it still need to be treated, or did it release as a result of the first release that was accomplished? And so on. So identifying those patterns is another part of the method, and we're going to talk about that in the next video. I hope you've enjoyed this video. I look forward to giving you the next video, as well as showing you a demonstration of the Hesh method in action. Thank you, and we'll see you soon.